Buenos días a todos y todas. Sean muy bienvenidos a este evento sobre
Good morning, everyone. Welcome to this event about global justice in vaccines. We're very pleased to have you all here with us at this event organized by the Association Universidad Autónoma Latinoamericana and Red Ética, with the support of the International Research Group for Global Statistics. We have two researchers and members. In order to approach this topic, we have Sridhar Venkatapuram, Gabriela Arguedas, and James Crombie, who I'll introduce shortly. Due to personal reasons, we weren't able to have Professor Einstein. We send her our best wishes so she can solve her issues shortly. So we thank Sridhar, Gabriela, and James for accepting our invitation. That is of high interest, especially regarding global vaccination. This discussion poses at least three key topics that I would like to address as a preamble to our chats. The first thing is the ethical grounds on which we could demand temporary waivers of IPRs regarding COVID-19 vaccines and related products, such as certain machines, considering the urgency to accelerate or to boost the rate of vaccine manufacturing. This waiver requested by India and South Africa last year with the WTO and supported by many countries has, however, been given rise to a lot of conflict and discussions between countries, especially due to the resistance and blockage of the European group and the US government led by Donald Trump. So this is going to be one of the key topics. The other one has to do with distribution, vaccine distribution. As we all know, in 2020, many countries were, a certain number of countries decided to purchase in advance a number of vaccines in case some of them didn't work. So many vaccines ended up being concentrated in few countries, whereas others, as we know, lack the vaccine or vaccines at all. So we need to figure out the alternatives to overcome this unfair concentration of vaccines. In fact, this has even encouraged tourism towards certain countries for people to get vaccinated. And many other countries have seen a lot of deaths due to lack of vaccines. And the third topic is the broad part of the IP, the TRIPS Plus. So how suitable or how convenient would this mechanism be, considering that in the short term, we might face a pandemic similar to the one that we're living right now. So there's a discussion about the limits or the boundaries of private property, corporate property, industry property on global public goods. It's urgent now more than ever, and it goes beyond this current situation of COVID. So these are the three key topics that we want to address during our discussion, regardless of the fact that we could address some other topics that are connected regarding global justice. Without further ado, I would like to start this conversation about our problems with the introduction of Dr. Sridhar Venkatapuram. He's a senior professor in his college in London. He knows a lot about justice in health, and he has been one of the first written one of the first published books regarding the legal ethic and ethic issues. Professor Venkatapuram is the current director of the International Research for Global Justice that supports this event and who we thank for the support. Welcome, Sridhar. You have the floor.
Good morning, everyone, and good afternoon and good evening to those of you that are joining from other places in the world and other regions in the world. It's an absolute pleasure and a privilege to be asked and to be able to join this conversation today. So I am going to speak for the next 10 or 15 minutes on the concept of vaccine equity and from my perspective. And I'm going to speak fairly slowly so that the interpreters do not have difficulty, which is great for me because this means I will have to say less, but hopefully I will say less, but more clearly what I want to say. So the two things that I would like to focus on in this in this 10 to 15 minutes, one is that I would like to focus a bit on how we got here to this situation. I think it's important for us to understand the different kinds of activities and events and institutions that have been involved in this vaccine fiasco, but also generally in this global pandemic response fiasco. And then I would like to focus on who is actually worst affected by our current situation and the lack of attention to the specific nature of who is actually suffering the most in developing countries. I'm going to use the word LMICs, low and middle income countries, for that. And I think both of these two things are neglected, and I want to give more attention to these two things. So firstly, while many of you, I'm sure, are experts in this area and know more than I do, I want to just review what I think are some of the important kind of facts of the situation regarding why we have such a global inequity and injustice regarding access to not only vaccines, but to a large number of other resources in order to be able to respond to COVID. If I could, sort of bring you back to 1 year ago, to April 2020, there was an international meeting hosted by the European Union. And it was supposed to be the first international meeting in order to figure out a global response to COVID. And it was also a way to raise money. It was identified by the politicians and policymakers and other institutions that there needed to be money raised for the global response, and there also needed to be coordination of the global response. And there was also a very clear sense, even at that time, that this was a medical problem that required a scientific and medical solution. And this also was considered to be a research and development problem, in that there needs to be a response to the virus, either from a vaccine or from other kind of treatment. For lots of these different kinds of reasons, we have this first summit of European, not only European governments, but also, all the rich country governments except Donald Trump and the US government, if you remember. And then also China, I believe, was not there, and Russia was not there. But also, what was also interesting for us to recognize is that at this meeting, there was also representatives of the world's richest health foundations. So the Gates Foundation being the number one, and the second, which you may not be aware of, is that the Wellcome Trust, based in London, is now the second richest health foundation in the world, and gives away about or plans to give away about £1 billion a year in health-related funding. As a result, this was they were there as well. And also various corporations were also represented at this meeting. And in that response, there was this recognition that there needs to be a coordination of efforts, but also that we need to find tools that need to be developed. So it is not clear to me, and I don't know the details of this, about whether the solution was already formed prior to this meeting or whether it was done during and after this meeting. But what the solution that this global meeting and gathering came up with was the creation of a new kind of mechanism or institution called the ACT Accelerator. And it was called the ACT Accelerator because the name was that access to COVID tools accelerator. And the idea was that in order to respond to this pandemic, we need diagnostics, meaning testing equipment and PPE and everything else. We need therapeutics, so which is sort of various kinds of treatments, and 3, that we need a vaccine. And these 3 were organized into what the term was called pillars. And then different organizations, 2 at least, were put in charge of each one of these pillars. And I just want to spend a little bit of time here because I think it's important for us to recognize that at this moment, there was seen to be a basis. And because we are an ethics conference, or today we're talking about ethics, I want to just highlight this part, is that there was this recognition that all of human beings on this planet were under threat and had a shared threat that they were experiencing. There was this seen to be a recognition of the need for cooperation. And there was an understanding that there was inequality among all the different people and societies, and that there was a recognition that we can overcome this. And this was one of the words that keeps coming up, is this idea of solidarity. And in that, they were sort of aiming to try to create this institution that addresses all of these different kinds of facets, but also brings a sort of response. What has surprised many of us, but some of us, or some have not been very surprised at what actually happened, which is that despite these mechanisms and institutions being created, what actually happened was that if you remember that the US government at that time and Donald Trump did not participate in this endeavor, and instead they worked separately and invested money directly into companies, or gave grants in hundreds of millions of dollars to various companies in order to come up with different kinds of vaccines. What they did is that this then suddenly raised this question about competition in the world, particularly among nation states. If the US were to come up with vaccines and Donald Trump did win the election, then the rich countries felt as though, or would recognize themselves at great disadvantage in the world. And therefore, neither would they have vaccines for their people, but then they would also have to deal with a US government, possibly with Donald Trump having the only available vaccines in the world. So you may now understand why the richest countries decided that they too will invest directly in pharmaceutical companies and vaccine research, so they too can have possible vaccines. What this did as a side effect, or maybe it's not a side effect, it's a direct effect, is that the vaccine facility in this accelerator was completely starved of its funding, and also starved of its greatest sort of resources, which is that the COVAX facility of the Accelerator needed rich countries to put in money in order to then pay pharmaceutical companies to come up with vaccines, which then it would distribute through the COVAX facility to both rich countries and LMICs. So by the fact that the rich countries then went around and tried to sort of make sure they have their own sort of potential vaccines, essentially undermines the COVAX. So you might be able to understand now why that kind of values about solidarity, mutual interdependence, mutual cooperation, while well-meaning, completely completely got undermined by the realpolitik of competition between nation states outside of that global sort of effort. So this is something for us to think about when we think about ethics and whether we can, at an international level or a global level, whether we can, what our ethics could be when only some of us try to follow certain kinds of ethics versus others, and what this means for the future. Nevertheless, despite this being the problem with COVAX and with the Accelerator, I do also want to say a few not complimentary words about the ACT Accelerator and the way that it's been functioning. One is that what we see is that it turns out that a very small number of people, particularly people who ran the foundations and also the richest governments, or maybe just even fewer than that, decided that they themselves had the solution for this, and that they themselves had figured out how to solve this problem, and they themselves knew who to hire as consultants in order to solve the technical problems. And as a result, what we have is this kind of mechanism that was designed. So for example, in COVAX, a rich country would be able to put money into the pot, they would negotiate a certain price for any vaccines that come out, and they would be able to buy vaccines to cover 50% of their population. Meanwhile, LMICs could or could not afford these vaccines could put in whatever money that they could, and then they would then get up to 20% of coverage for their population. So one might ask, why 50, why 20? So some consultant at some consulting firm came up with the idea that in LMICs, approximately 20% of the population works in healthcare, and therefore countries should be then allocated vaccines up to 20%. So many of us will laugh at this proposition that either the 20% work in healthcare, or that if you just calculate 20% and hand 20% of doses to the government, that they will somehow get to healthcare workers or other people that are in need. So that I leave aside, but I just want to tell you that from an ethical point of view, in terms of what we think about global governance and global ethics, there's profound things that went wrong, and that perhaps we, from who are working in political philosophy or ethics, would find quite troubling to say, how is it that people who are incredibly well-meaning, incredibly well-educated, incredibly well-resourced, would then make these kinds of decisions at this particular point in time? The second point that I want to go to, and I am now looking at my clock and I see that I'm at 12 minutes, so I will do this in 3 minutes, which is that you will hopefully also share with me the recognition that as we look at how COVID is spreading in LMICs, there is very little information about actually the distribution of deaths and suffering within these LMICs. All we hear about is the aggregate numbers. One of the problems is that data collection and data infrastructure tends to be weak in LMICs, but at the same time, compare this to how we got information in rich countries about who was getting sick, who was dying, who was in the hospitals, who's getting vaccinated. The entire concern was this idea that this population, this COVID pandemic is not an egalitarian pandemic. It actually kills the most vulnerable people in societies, whether biologically vulnerable or socioeconomically vulnerable. And in rich countries, and still today, one of the group that has been dying as a result of COVID is older people. But what we see is that there is absolutely little information that's giving us a picture of who is actually dying from the pandemic. This, to me, is both an indication of the kind of stereotypes and biases that we have about LMICs and how the media represented it, but also it actually has a great amount of implications for equity in LMICs. This, when you do not have a detailed picture of the distribution, then the solutions will benefit the wrong populations, usually the middle class and the elites. This is not a rhetoric that I'm saying is that if you look at how HIV was securitized and made into a security problem, and then you see that the solution, actually the resources for preventing HIV went to things like elites and the army and the middle classes, while the most vulnerable populations still today are not recognized by governments. And so we see that what we need to do at this point, and I hope that we will discuss this more, is that we need a greater attention to the social patterning of deaths and suffering in LMICs in order to be able to not only acknowledge their deaths and suffering, which is a matter of equity and justice itself, but that the solutions that we provide in order to address this problem go to where they are needed the most. One, because the people who are dying need attention and have needs that must be met. But second, it's also because that is where the best interventions will have the greatest impact on containing the pandemic within countries, but also across countries. So the relationship between vaccine injustice globally has a very direct impact on the increasing inequalities and deprivation of the worst off in poor countries. And the greater amount of time that we let this kind of generic picture continue, the longer this deprivation and suffering is going to continue, and the pandemic is going to just become endemic and become yet another pandemic that affects the worst off in these countries. So with that, I want to thank you once again for inviting me to this conference, and I hope I have added something to your knowledge, and I look forward to the discussion. Thank you.
Muchas gracias, Sridhar, por tu intervención. Son varios los puntos que tocas que resultan fundamentales para la consideración ética del problema de la distribución global de vacunas, de los dineros y esta aproximación crítica sobre el modo en que todo el proceso del COVAX y del acelerador fue capturado, digámoslo así, por la tecnocracia de la gran industria farmacéutica y de los países ricos y las élites globales. No sé si alguien quiere hacer alguna pregunta.
I don't know if someone wants to ask any questions. The chat is available for all our attendees, so you can share any questions, any remarks that you want to ask our guest panelists. All right. In the meantime, let's give the floor to our dear Gabriela Arguedas. It's a pleasure to have you with us. Professor Gabriela is a pharmacist, bioethicist also, and she works as an associate professor in the Université de Costa Rica. She has a great trajectory in bioethics and IP. Gabriela has been an activist on regulations on IP, specifically related to medications and vaccines. She's currently a member of the International Research Group for Global Justice and also the International Bio Rights Network. You have the floor. It's a pleasure to have you with us. Thank you for your invitation. I'm very pleased to participate in this event with so many dear people and friends. I'm going to share my screen, although I don't have authorization to share my screen. Will you please help me with this?
Muchas gracias, ya puedo hacerlo exactamente. Entonces, vamos a ver si podemos pasar esto rápidamente. Muy bien. Bueno, lo que quiero compartir con ustedes en esta mañana es una reflexión sobre...
This morning, I want to share you some reflection about global justice and vaccination, looking on Latin America, not only regarding what's going on, but also addressing our contributions, our decade-long contributions, which will allow us to think and ponder deeply about the current situation in Latin America and the world. As I have just said, in Latin America, we have a long trajectory, a long history, not only about social mobilization, but also scientific and academic analysis on the meaning of the human right to health and what we can do or what we need to do so that that human right is no longer just a mere intention that politicians and opinion leaders mention in their speeches, but to make it a reality. In order to put ourselves into context about what's going on in the world regarding access to vaccines, we need to take a look, or a broader look, at what has happened during the latest decades regarding general access to the benefits of science and technology. Latin America has a very rich tradition on the relationship between bioethics and human rights, and it is very important to compare it with the US and Europe. And just to quote a few significant persons in the region that have contributed: Juan Carlos Tealdi, Volney Garrafa, Florencia Luna, among others, Eduardo Rueda, we have here, the Bioethics Network and UNESCO. And regarding the social mobilization for the right to health, I want to highlight ALAMES, the Latin American Association of Social Medicine, who I'm sure James Crombie knows very well. So in this region of the world, we have faced the pandemic and the huge inequality that has brought the death of hundreds of people from a certain point in history. So we need to put that into context. That's why I have said in other forums that the response of the most powerful countries has not been, for many in Latin America, any surprise at all. The surprise actually should have been a response based on global ethics or a certain feeling for collective well-being. In order to understand why we are not having access to vaccines, we need to also understand why we're not having fair access to medications overall, to medicines. This will allow us to understand why it's no surprise what is going on right now. As many other areas in the global south, Latin America lives among forgotten medications and rare diseases. This is one of the main barriers. Diseases that affect the largest part of the population in the global south do not receive the same attention in therapeutic alternatives and medical research as the diseases that affect population in the north. Also, medications that can be useful and even easy to produce to treat diseases that are mainly present in the global south, well, we hardly find pharmaceutical industries that want to produce them because they don't serve their commercial purposes that respond to the tenet of quick return on the investment. They're so cheap to produce and cheap to sell that they're not attractive as a commercial investment. Hence, they are not produced. They need to be produced locally, and this is one of the main problems, that the global south is losing its ability to manufacture medications. Regarding high-cost medications, those that are not generic and cannot be produced locally, we have some other issues. High cost of medications is partly due to the current IP norms, but it's not only that. Price of those medications is defined by certain negotiations that are not transparent and imposed by the pharmaceutical industries when they decide which countries can receive and which countries cannot receive their medications. This requires state or government and global regulations. But pharma lobbying pushes the whole world towards a deregulation of medication prices, and it's affecting the whole planet. Therefore, public health systems are being pressed or receiving pressure due to the high prices. Pressure for deregulation has also led to privatization of healthcare systems. So on one hand, we have the high cost of medications, and on the other hand, we have the privatization of the healthcare systems. And this leaves a lot of people without access to basic healthcare and, of course, with no access to medications. Also, the IP rules make us dependent on imports. This leads us to the COVID-19 vaccines, that they have a dual nature. Vaccines against disease are dubbed or characterized as a scientific milestone, and their distribution is characterized as a catastrophe. That's the dual nature. Production generally is very complex, very difficult, and very expensive. So the pharma industry are not generally interested in going into vaccines unless they have a certain financial guarantee. This is even more true during pandemic times, when we needed a record-breaking production time-wise. We needed to produce not only one, but several vaccines that are safe and efficient in less than a year. That hasn't been seen before. But as we celebrated that success of science and technology, we were also warning the fact that we couldn't see enough global political will to have a fair distribution of this product around the world. Some people say that the pharmaceutical companies have used private funds to develop these vaccines. Others say that those private funds are not actually private, but they come from public taxpayers' money. So why has the production and distribution process have been a moral failure? And including production because we haven't been able to scale it enough in order to address the needs of the whole planet. So the first point is because the rules of the pharmaceutical game did not change during the pandemic. We saw the whole planet go into lockdowns and take or impose drastic health measures, suspension of international flights, things that we believed were impossible. Manhattan completely empty, for example. We saw extraordinary things, with the exception of a change in the rules of the game of medication manufacturing. This leads us again to a ages-old discussion in which Latin America has taken part of medications as goods for a market or goods for people. It is true that developing vaccine requires several things to take place at the same time in order to have a vaccine candidate that is safe enough. This demands great investment, and it poses a financial uncertainty for pharmaceutical companies, and they require some sort of certainty. But at the same time, IP or industrial secrecy or confidentiality agreement mechanisms are also enforced. This has not allowed COVAX to work. My colleague Sridhar has already explained this part here. Some other rules and practices that didn't change during the pandemic have to do with the global north and global south division. This moral failure in the production and distribution of vaccines, it's not my appreciation, it's the WHO that has said it, implies thousands of deaths and millions of sick people that can be living prolonged consequences. And this implies a differentiated valuation of human lives. Let me explain it. The moral failure lies in not having avoided, even it could have been, but we couldn't do it because we are still facing this north and south division. Let me delve into this. We currently not only have a shortage of vaccines, but also oxygen. Let's think about what does this mean for a hospital in a poor area in Latin America, not having oxygen and seeing people die when they could have lived by just having access to oxygen. This could be classified as a cruel and inhumane treatment. So this brings me back to my previous questions. Are medications market goods in a situation such as a pandemic, or commercial goods as mobile phones, cars, or shoes? In the pre-pandemic world, we were already asking ourselves this question, but it's possible that we are in a crisis not seen in 100 years and still not having an acceptable answer. How has the national and international regulatory framework been built to allow pharmaceutical companies to impose their maximum return on investment scheme even during a pandemic? Now, should this be a surprise? When we see patients demonstrating in the US fighting for the right to insulin, is this unexpected? Is it unexpected to see demonstration in one of the most powerful countries in the world? And this is a 5-6-year-old problem. We've seen these demonstrations for 5 or 6 years because there are people dying in the US because they don't have access to insulin. This is a continuum of structural injustice that apparently is impossible to take down. Now, thinking about the future, what's the research, development, and innovation for the global health in the future? What do we need to understand once and for all to avoid such a dramatic and hostile future as the present? I want to go back to this document that is about 10 years old, the Manchester Manifesto, Who Owns Science? This manifesto, coordinated by 2 Nobel Prize award winners, brings the discussion. The results, who owns the results of science and technology, actually? Can they be purchased? Can we put a price on COVID vaccines and insulin? There's a market price, but there's another value, which is human life, intellectual property, technology transfer, and the production of historic dependency relationships that produce neocolonialism and extractivism are at the central point of the discussion. Intellectual property, as I said, currently is not only used to reward research, but it mainly has a political purpose, which is to bring permanent technological dependency and establish subordination relationships. Hence the need of TRIPS waivers. This has to do not only with justice, but also to build capabilities between the North and global North and South in order to reduce this technological dependency. And this is also useful to draw the global attention on the need to reform the global intellectual property system. Also, we need to rethink the social determinants or drivers of global health. These are the pieces of the puzzle to control and adapt to the pandemic. We need to come back to common goods. We need to build health, and building health requires basic things such as access to drinking water, livelihood, health systems, etc.
Y creo que se me está acabando el tiempo, por favor, me dicen, pero ya mi último punto sería que la concentración de las vacunas responde a un patrón jerárquico.
It responds to a hierarchy pattern that was described. The division between the human and the non-human things. But it doesn't only respond to this pattern, but it also responds to what Judith Butler described as the lives that are worth enough that people cry when they are lost. There are lost lives in this pandemic that doesn't hurt too many people. Disposable lives. That is clear in this pandemic. In the meantime, evolutionary biology makes that variables arise, that this distribution of the value of life between the global North and South has an ecosystemic result. That implies that the pandemic will not end soon. I finish with this image that I found yesterday, where you can see this comic. Thank God the corona is already controlled. You can see this image where the virus is controlled and not controlled. It's annoying to hear people in some countries where the distribution of vaccines has been very successful. They say that we are going out of the woods in regard to the pandemic. And I close with this sentence. It's a crime to allow a death to happen if we could do something to avoid it. It seems that among the international decision-making bodies, we need to have this introductory class again. Thank you very much. Thank you for your presentation, Gabriela, which was very clear. While you think about some questions you want to ask to Professor Gabriela, I would like to ask to Professor Venkatapuram some doubts that our attendees have expressed. The first one is, how can we start to remove the public health politics? What are the alternatives to eradicate this geopolitical capture? What solutions can we see in the short terms? What type of reforms we can think about multilaterally? What is your opinion? You have the floor. The floor is yours.
Okay. Gabriela, do you want to also chime in, or should I go ahead?
You can go ahead and then I can say something.
Okay.
No, you go.
Yeah, so I really appreciate the question here about removing politics from public health. But I want to say that I think we are not doing the subject justice by thinking that somehow politics is separate from ethics and global justice. One of the reasons that I became an academic philosopher and particularly interested in political philosophy was not just to think about perfect ideal solutions, but to find out how we can translate the ideas into policy. So what we are seeing here is essentially politics with poor ethics, not politics with no ethics, or politics going into where things should not go into. I think this is also, many of you who are philosophers of science would also see that this is question about how we do science, whether we are really as objective as we think we are, or whether there's always values that come into the science as well. So this idea that somehow public health ethics is something that's separate from politics on the one hand, and that somehow politics should not go into public health science on the other hand, are both, I think, potentially difficult things to pursue. I don't think that they're correct sort of paths of reasoning. In fact, what we need to do now, I think one of the things that I've learned a lot is not only to get better arguments and solve some of these problems about how do we balance, national self sort of interest regarding the health of people within countries, as well as the interdependence that has sort of become so clearly available, sort of clearly come to light, and also sort of thinking about the future, is that we don't think about it in terms of non-political solutions, but we think about it as political solutions, but with better ethical foundations. And I think that there'll probably be more answers from the other speakers as well, but I just wanted to, just very simply say that it's not politics out of public health, but actually public health doing better ethics, and to convince the politicians why a certain approach is better than another approach. Thank you. Over.
Muchas gracias, Sridhar. Excelente.
Thank you, Sridhar. Excellent. In the same line of this question that Sridhar has answered, Gabriela, the Professor Miguel Polo from Peru, how would you assess the intervention of the international organizations in relationship with the pandemic, for example, the UN and the OEA? Thank you for the question. No doubt, the decision making at a global level in institutions such as the United Nations has been marked for these submission relationships from north to south, and the inability in the Latin American case to create a kind of cooperation organizations in emergency situations that allows us to address the necessities of our population. There could not be an adequate response to a pandemic when we live in weak democracies. And I agree that politics it's not possible to take out politics from public health. In Latin America, we need to differentiate what the politics means to the bad practices in politics that we are used in our region. But with no doubt, we need to discuss what does it mean a state that responds to the needs of its population, and what the relationship is between a healthy democracy and the social production of health. If that exists, we can also make international coordination more effective, and that is not responding to the elites, but responding to the populations. The UN and other organizations are delegitimized in the context of this pandemic, and the result is that the global south has been a victim of this geopolitical game of the distribution of vaccines and the vaccines diplomacy and donations, because donations are not free. Donations, wherever they come, are associated to a geopolitical process that leaves us in a situation of vulnerability. Thank you, Gabby. Questions keep coming. We're coming back to those questions, and now we'll have Professor James Crombie, who joins us from Santa Ana University in Canada. Professor Crombie is a philosophy and bioethics professor in the University of Santa Ana and has focused in the dynamics of the pharmaceutical industry, considering the needs of the global south. He has been an authorized interpreter.
Professor James, bienvenido.
Professor James, welcome. The floor is yours, and thank you for joining us.
Muchas gracias, Eduardo. Voy a hablar en inglés. Hello, everyone. I want first of all to express my sympathy for Ames Dye, who I had hoped to meet as part of the audience, especially the sympathy is in view of the sorrowful circumstances which have prevented her from being with us. This webinar is about vaccines and justice. It's also about intellectual property rights over medicines in the context of a global state of emergency created by a pandemic. It also involves several additional related issues. For the record, I will state at this point that I have no financial or other conflicts of interest to disclose with regard to vaccines and other pharmaceuticals. Also, for the record, since everyone knows this, we remind ourselves that intellectual property rights, so-called, importantly include copyrights and of course patents. At this point, I'm going to try to share my screen. I have a couple of slides, not many, given the short time I had to prepare for this talk. It's worth mentioning that intellectual property rights include not only patents and copyrights, but also trademarks, designs, trade secrets, and other documents which an individual or a corporation may want to keep confidential. And not just patents, but also trade secrets and access to processes and clinical data can become important in the context of health. Now, am I going to be able to switch my slide? It looks like I'm not able to do that. Here we go. Intellectual property rights are protected by what is called the 1994 TRIPS Agreement, one of the founding documents of the World Trade Organization. TRIPS is the acronym for Trade-Related Aspects of Intellectual Property Rights. In Spanish, ADPIC for Aspectos de Derechos de Propiedad Intelectual Relacionados con el Comercio. The TRIPS agreement it is the result of the work of the architects of the globalized economic system that has been developing since the Second World War. GATT became the World Trade Organization in 1994-5. And let's see, the introductory text asks us whether there might be ethical grounds in the context of a global pandemic for demanding temporary waivers of intellectual property rights over vaccines. In spite of the strength of the verb to demand, the question is perhaps not sufficiently radical, since it engenders the further question, why temporary? We may also wonder, why just vaccines? Much of industry resistance to temporary waivers is in fact probably attributable to worry that many arguments in favor of temporary waivers may be subsequently used in favor of what might be called permanent waivers, i.e. abolition. There is the further entirely justified worry that many arguments which apply to the availability of vaccines also apply to the availability of diagnostics, medicines, devices, PPE, and even hypodermic needles, as we shall see. The answer to the question why temporary is perhaps that in the present context, we are more in the position of firefighters in a city which is burning than in that of a commission appointed to review the building codes and the organizational organogram of local government. The answer to the question why just vaccines is perhaps that in spite of the importance of vaccines, we should not concentrate exclusively on them. It's worth remembering that the memorable HIV/AIDS pandemic, which began in the early 1990s, has not yet really produced a good vaccine. It's also worth noting that in order for a laboratory in a developing country to produce a patented product, such as a vaccine, it is usually not enough to have a copy of the patent and the authorization of the patent holder to go ahead. In many cases, there is special technology which must be acquired and processes falling under trade secrets which need to be communicated. There's also the matter of training of staff. So when there are generous offers of perhaps renouncing patents, in the case of AstraZeneca, etc., one wonders whether this also includes an offer of appropriate technology transfer and other organizational assistance which might be required in order to actually produce vaccines in location. This is actually happening in some countries to some extent. And it's, I already mentioned about the health practitioners. On the subject of devices, it's perhaps worth mentioning, as I just did, by way of avoiding getting entirely hung up on patents as the sole cause of vaccine-related injustice, that the nation state of Cuba has had to contend not with a shortage of vaccine per se, but with a shortage of hypodermic syringes attributable to an economic and financial blockade imposed by the United States. As is well known, in addition to providing teams of medical professionals to help other countries deal with the pandemic, Cuba has developed and is producing several of its own vaccines. Cuba, unfortunately, depends on imported hypodermic needles. Another source of vaccine injustice, as the other speakers have also mentioned, is vaccine nationalism. A recent, just a small anecdote of a small piece of injustice, which is the tip of a very large iceberg. In the Canadian news media recently, there was the story of a married couple returning to Canada from outside the country. Both members of the couple had been fully vaccinated, but the vaccine received by one of them, who at the time of vaccination had been in Tunisia, was Sputnik V, the main Russian vaccine, which has not been approved by Health Canada. As a result, one member of the couple was authorized to enter the country without quarantining at point of entry, while the other member of the couple was not so authorized. I resist the temptation to analyze further the nature of this type of injustice, but it is a form of discrimination practiced against the residents of countries with limited access to the expensive vaccines recognized by hegemonic countries. Returning to the matter of patents, it's perhaps worthwhile reminding ourselves that a patent is essentially a monopoly on the manufacture and sale of an invention, which is granted to its inventor by a government for a limited period of years. Joseph Stiglitz remarks ironically that neoliberals in favor of minimal government intervention are nonetheless often very fond of intellectual property, in spite of the fact that intellectual property requires a good deal of government intervention and could not possibly be enforced in the absence of a strong state. The invention to be accepted under a patent must be deemed to present both novelty and potential usefulness. The artificially high price of the patented product is argued to be compensation for this usefulness and to constitute an incentive for further beneficial innovation. Other people, and I myself, have dealt with these dubious arguments elsewhere, and I won't go into them now. The rights conferred by the granting of a patent may be and usually are sold or rented out, so to speak, by the inventor, or transferred by license to other persons or corporations. The paradigmatic license is, of course, voluntary. When the holder of the license is required by force of law to grant a license, when the holder of a patent is required to grant a license, the license is termed compulsory. More on compulsory licenses shortly. The history of patent law varies considerably from country to country. And for example, in France from the 1840s for 100 years and for 100 years thereafter approximately, it was not allowed to patent a medicine. The 1994 TRIPS agreement is somewhat of a revolution in world history, trying to impose a uniform system on the world. Joseph Stiglitz remarks after considerable analysis that the TRIPS agreement is not particularly in the interest of developing countries. Now, by way of not appearing I'm going to stop my share for a bit. By way of not appearing completely unethical and heartless, the TRIPS agreement provides for government intervention on the question of prices and availability of medicines in the case of health emergencies like epidemics of malaria or HIV/AIDS, as was occurring during the early 1990s as the TRIPS agreement was being implemented. Anyway, under the TRIPS agreement, and this was made clearer by the Doha Declaration of 2001, national governments are allowed to take appropriate action by taking advantages of the flexibilities provided for by the treaty. And the best known of these is the compulsory license, under which, if the patent holder is unwilling or unable to produce the quantities of the required medicine, the government of the affected country can give the contract to another laboratory. Strangely, this provision is more often used by richer countries than poorer ones. Canada, for example, used a compulsory license to have a local generic company produce millions and millions of doses of Tamiflu, which ended up never being used. This mechanism is not usable by countries which do not possess a local pharmaceutical industry capable of producing copies of medicines invented elsewhere or producing their own. And this is compensated for by another mechanism, parallel exports. And in September 2007, Canada became the first country to use this provision to issue a compulsory license authorizing a Canadian company to make a generic version of a patented drug for export to Rwanda. And the company Apotex was authorized to export 260,000 packs of Apotriavar, enough to treat 21,000 AIDS patients for a year. This seemed to be a very hopeful opening. However, strangely, the experience has never been repeated. I think there was a second company investigated the possibility of using the Canadian system, the regime for access to medicines of Canada, the CAMR. It seems that it's because there are numerous bureaucratic obstacles to actually getting an application approved. And this appeared more recently when in news that was not widely reported, but in May and June, we learned that the new Bolivian government had negotiated a contract with a Canadian generic company, Bioethicist Pharma, to produce 1,500 million doses of a COVID-19 vaccine, the Johnson & Johnson one. And the idea was to, well, first of all, Johnson & Johnson refused to provide a voluntary license to Bioethicist to produce this vaccine. So the application was made to the Canadian government for a compulsory license to be issued for Bioethicist Pharma to be authorized to produce these vaccines for Bolivia at a more affordable price, I suppose, than Johnson & Johnson is actually asking. Anyhow, there's more to this story, and it turns out that the category of medication that Bioethicist Pharma wants to make is not on the proper list of the head bureaucrat who's in charge of issuing these licenses, and the whole thing seems to be bogged down. But this is, I think, a symptom of the contrast between pious wishes and posing as doers of good and the actual practical results that these things can produce. So I think I will stop there. Although one remark with regard to my metaphor about fighting fires in a burning city, this question of strategy of how to manage an ongoing crisis, which is constituted by a pandemic on the one hand, and keeping in mind what a proper way to organize things in the future might be on the other. It's, you know, in Florida with their collapsed building at Surfside, there's not too much talk right now about how the building codes should be changed, but there will be a time for that. Maybe the time is already now in the midst of trying to deal with with the present crisis. Kant makes Immanuel Kant, the philosopher, makes a remark somewhere. Not just a remark, he has a whole series of reflections about this concerning what obedience we owe to the law in a despotic kingdom like the one he lived in, as compared to an ideal republic, which can actually generate authentic ethical obligation to obey the law. And his answer was that the claim on our obedience of a defective regime is the extent to which it can behave like a proper regime would behave. And in the short term, that's, I think, the best we can expect of the current structures, that hopefully what we want is for those who have the right to treatment and access to vaccines should have this access. And if it happens by somewhat irregular, in a somewhat irregular structure for the time being, we will be happy for that, although we'll continue to work for better structures. Okay, thank you.
Thank you. Gracias, James, por tu intervención. Tenemos muchas preguntas.
Thank you, James, for your presentation. We have a lot of questions from our audience. I would like to start with Eric's question that addresses Sridhar's and James' speeches. Talking about the compulsory licenses. Here's the question. Could we consider that the COVAX scheme is actually a way to mask an effort to protect those agreements, the TRIPS agreements that actually monopolize innovations, thus making or hindering or curtailing access? Couldn't we think that COVAX is just more of the same in order to avoid the TRIPS agreements to be modified, and thus enabling these agreements to stabilize? I would like to give you the floor, James, and we'll continue with more questions from our guests.
Okay, thank you. Much of the question in the way that it's formulated
En la manera en que se formula la pregunta realmente adelanta mi respuesta. Yo estaría de acuerdo en que COVAX
place in order to be able to say that something is being done, but the half-hearted effort put into COVAX by the richer countries was not really proportional to what the system was supposed to be. And yeah, I recall actually that there was a bit of an embarrassment that Canada, after investing perhaps not entirely insignificant amount in COVAX, has actually been taking vaccines out of the system, whereas given the privileged position of Canada, it might have been more decent to leave those several million doses in the system to be divided up among other countries. And COVAX itself, I think, was a kind of a second best scheme with regard to CTAP, which I think got more or less abandoned. But in any case, we are faced with structures which Sridhar knows better than I do, but which are not anywhere nearly commensurate with the kind of task they should be accomplishing. I'll stop there.
Okay, James, thank you. Gracias. ¿Qué opinas, Sridhar, de esta pregunta que
Thank
hace?
you. What do you think, Sridhar, about Eric's question and regarding what James has already said? Would you like to add something?
So, so I have an easy answer and a complicated answer. I'll give you first a quick answer. I think that the COVAX facility was set up with full awareness of the WTO, the TRIPS agreement, but also compulsory licensing mechanism within the WTO and also the potential for a waiver. I think we don't have enough time for everyone to kind of go through the different possibilities within the WTO. So whether you go a compulsory waiver sort of way or a public health emergency waiver, et cetera, I would encourage you to look at one of the seminars that our group, that Gabby and my group did with one of the former people at the WTO, explained very clearly what the different issues are. So the idea was that the COVAX facility was set up because fundamentally it needed a mechanism in order to funnel funds to companies. And this is what CEPI is about. CEPI is the Coalition for Epidemic Preparedness and Research. And I'm sorry, I don't know the exact title, but essentially it's very much about funding research into vaccines and other sort of research that help address pandemic infectious diseases in particular as the foremost attention. And so the idea of compulsory licensing and waivers are about once a company already has some product, then what are the different ways in which governments and other companies can get access to the recipe or the process of that product? COVAX is not about getting access already to something. It was about actually fundamentally supporting the research and development for new products and then getting access to it. So that's the simple answer. The more complicated answer is that COVAX is fundamentally based on a private sector model, which is that they were planning on giving money through fundraising to funders and governments to private sector pharmaceutical companies in order for them to produce products which then they could sell to countries at a reasonable profit. And this is a more complicated picture, is that we are currently in a situation in which most international organizations and the richest countries, their de facto template or model for addressing health problems is to work through the private sector, through private companies and through private companies, whether it be research or implementation, et cetera. So the one startling thing that's different is that the United States in this year said basically they would support a waiver at the WTO, which they have not done in decades. They have never done it. Even at the height of the AIDS epidemic, they would not allow a temporary waiver. So partly because the United States' reputation has been so terrible over the last 4 or 5 years, and a way to regain this idea of the United States as being a leader in the global arena, they have made that move. Whether that move actually gets realized is really not that important. It's politically very important because it then produced a pressure on the European countries to do something more, because the United States is now not on their side. So there's more complicated things going on in the background, but I would say we have more of a problem about health and a public health good as being in the private sector model. And I don't necessarily have a problem with that, but I just want us to recognize that. But also this pandemic, and this is a separate topic, has essentially shown how big technology companies have essentially entered the public health space while governments have retreated. So all the contact tracing apps, all the epidemiological work, all this other stuff is essentially technology companies are now moving to a space where the government has essentially said, we're not going to try to compete. We're not even going to try to do it. We're going to essentially buy the services or allow these companies to make deals so that, in order for their service during this period of time, we will ensure that they will get more access to the health sector later on. Thank you. Over.
Gracias, Sridhar. Excelente. Gabriela, ¿querrías agregar algo sobre el punto?
Gabriela, you wanted to add something? Yeah, thank you. The question is very enticing. I would like to stress on the fact that, as I already said it during my presentation, in fact, the new medication production model did not change during the pandemic. The WHO, as well as the most economically powerful countries, went for the business as usual model. And this is very noteworthy. It's impossible. I can't wrap my head around the fact that this pandemic wasn't able to bring a new model, a new discussion. The only thing that changed was the acceleration of the process and mechanisms, schemes such as COVAX and others, such as special fundings from the US government for pharmaceutical companies, or special funding from European countries for their pharma companies, and extraordinary or expedite approvals in the FDA. That changed, but there was no way to change the way to produce quick solutions collaboratively between the public and private sector. So basically, the public sector funneled resources to give them to the private sector to come up with a solution that would come from a private model and not readily available for the whole world. So what I want, the thought here is that a crisis like this one that locked down people for months wasn't able to make us think about technologies as public goods. When are we going to have that discussion? I believe it's impossible then in order to be able to talk about common goods in health.
Thank you, Gabby. In the same discussion line, a question for all three speakers by Anna has to do with the fact that we have to questioning if we are in a situation that would justify a radical change in the global economic order. It's not this situation that simply requires reforming public policies, but are we in a situation where we would need a transformation of the global economic order in times where we also have been having critics to neoliberalism? How do you see this subject? This needs to start being a central issue when thinking about global health equality. Gabby, you have the floor, and then James, and then Sridhar. Okay. This is a very wide and complex question. Maybe what I can say and add, because I don't want to repeat things that have been already said, are 2 points. First of all, some scholars and academics in some European countries have been working in the new feudalism concept. They say that this extreme phase of neoliberalism that we are going through a philosopher talks about this extreme phase of neoliberalism that implies human sacrifices, and that has been very clear by the pandemic to see what the human sacrifices has been made. And the other scholars, Olaf Kalkmeyer and others, talk about neo-feudalism. We're entering in an age of neo-feudalism, in a accumulation, a dispossession that leaves great populations in a situation of not even being a third-class citizens, but they are property of others that could have seemed an exaggeration some years ago, but I am convinced that these academics are right. If we see the death toll in this pandemic by racial groups and nationalities and so on, we see that the death toll is accumulating in some groups that carry the damages of former generations produced by inequality. And so definitely we need to look for a way of changing this model in terms of life and death, but it's difficult to open that discussion. Even if evidence demonstrates that it is necessary, it seems that politically the discussion space seems to be closed.
Okay, thank you. I agree partially with Gabriela that the current situation seems to be developing in a more and more catastrophic way. I suspect that we are headed towards some fairly impressive catastrophes before we get things better organized. I must admit to have not really organized my thought with regard to an overall strategy for what we should be doing now and what we should be aiming for in the more limited area of health and pharmaceuticals. It seems to me not the proper arrangement for private companies to be choosing to be doing research and making and holding patents. I think that to the extent that patents should be allowed, they should be held in public trust, and calls for tenders could be issued for products that were justified, that were deemed to be worthwhile spending public money on, and in this way, some of the irrationality of how the medical and pharmaceutical system works would be avoided, at least partially, in that, for example, a bit on the model of the Cochrane Group, looking at non-pharmaceutical measures that can be taken and comparing them to pharmaceutical ones and so forth. But I don't think that pharmaceutical companies should hold patents. Usually they don't invent the medications in the first place. They buy the patents from researchers in universities who have actually made the discoveries. And I think they probably shouldn't be engaged in marketing either, neither marketing nor research to discover the new products, but merely submitting tenders for the production of the chemicals that they are asked to produce. by public authorities who would rely on the research of publicly funded organizations. Anyhow.
Thank you, James.
Yeah.
Yeah, thank you very much. Sridhar, what's your opinion?
Sridhar.
So if I understand it correctly, I'm going to try to simplify your question into, so what should we do? And so I think I would say two things, and I think this is a really important thing, is that so many panels that I have participated on is usually about describing what has happened or what is happening, but very few sort of about what we think should be the solution or what the right response is. And I think this is one of the fundamental purposes of ethics and ethicists, is to reason about what should be rather than, you know, discussing what is and what's happening. And I think so in that, this is one of the reasons that I wanted to be on a panel and among a community of ethicists, because we are used to thinking about what is the right or the best way in sort of thinking about response and social response and how should we go forward. So with that, there's, you know, two things that I want to say. One is that this pandemic is not just a scientific crisis about scientific research or IPO. This is a fundamental global, not only a health crisis, but it has also brought about an economic and social crisis of many dimensions. And you know, we have profound human deprivation in multiple dimensions happening in every society, and now also across societies, we see this happening as well. We also have, beyond this, the climate heating crisis and the loss of biodiversity. We also have, I think, as you know, some of you have already pointed out, this sort of you know, issues around gender and race and sexuality and white supremacy and decolonization and colonialism, new colonialism. We have the ongoing refugee crisis, and then we've also seen, with since 2016, the rise of authoritarian governments in the largest countries in the world. And so all of this is not, you know, individual separate things that are happening. This is all a reflection of a more profound point in our societies. I tend to be optimistic, I think. I think my, you know, for a variety of reasons, I don't know if it's a personality issue or a generational issue or what it is, but I tend to be more optimistic that cometh the problem, cometh the woman to solve the problem. And so I think that there will be always potential that we can come to that problem and we can sort of solve it. Now, the thing about how exactly to solve it, there have been many ethicists and philosophers who I admire who have sort of started to provide solutions in a very technical way. They start to say, well, I can design a better delivery mechanism for vaccines or production mechanism stuff. So my strength is not in the technical part. My strength is in the ideas part, because that's why I'm a philosopher, is the concepts, I think, is really important. And I want to encourage us to, you know, the questions that we were provided in the beginning, I sort of, you know, are really good. But I also want us to stop, and this is my personal opinion, is to stop think that global justice is about what rich countries can do for poor countries. I think that framing was profoundly problematic 20, 30 years ago. And it's even more problematic now, is that this vaccine inequity problem isn't about what rich countries can do for poor countries. You know, if we had another hour, I would tell you about what I think the moral causes of this pandemic are and who's responsible for what causes and who's responsible for correcting those harms and what role rich countries have to correct those harms, whether it be in the spread of this pandemic or prior to the causes of all of this. So I think that one is that we need to rethink about our questions. are ethical questions and are questions about whose rights and responsibilities, whose debates and duties that we have. So at present, I don't think the problem is what can rich countries do for poor countries. That's, I don't think, is the moral problem, nor the sort of simple problem. I think we now have to think about what do we do with the situation of global interdependence, where harms are being spread as much or more than the benefits that people talk about in this global interdependence, and what sort of mechanisms and principles do we start to identify to sort of regulate those harms as well. I also am profoundly upset about the lack of language of human rights over the last 2 years, this last 18 months, the absolute lack of any sort of language about human rights from the United Nations organizations, from the WHO, from the biggest funders, even the governments have not talked about it, as opposed to in the 1990s and HIV, it was all about human rights and how everybody has an entitlement to live and to access to medicines. And so these are, I think, the projects that I think are in front of us, and I'm optimistic that that we will do something about it. And so, yeah, I will end there. Thank you.
Gracias, Sridhar, por tu respuesta.
Thank you, Sridhar, for your answer. In line of what you were saying, there is a specific question in relationship to if you think that the decision according to which India sent vaccines to developing countries is fair, while vaccines were needed at home. What is your opinion? Is it fair?
I mean, I think the answer, is very simple. It's not fair. I think what was happening was that there was a gross underestimation of the problem within the country, and there was an effort, to be able to play geopolitics, particularly against China. And so what India was doing is that, while people are talking globally about what the G7 is doing, you have to remember that each region has its own local politics. And so the way that India was dealing with their regional politics was to try to ensure that they still have influence among countries like Sri Lanka, Bangladesh, Bhutan, Nepal, etc. While China is now actually, we know very little, but we know that China has been distributing its vaccine across Africa and across Southeast Asia and some Latin America as well. So India is very concerned about its loss of influence in those regions. And so that's why, and right now the most valuable commodity in the world is a vaccine. And so that's the thing that it will trade. Next year it might be something else, but right now it's vaccines and that's what it's using. So it's definitely unfair within domestic in terms of the people that are dying without the lack of vaccines, but easily the leader could argue that for the long-term benefit of my country, I'm using the vaccines that could save lives within the country to promote sort of greater something for our country in the long term. But as we know, we can make any arguments that we want to sort of defend a position that we've already decided on.
Muchas gracias, Sridhar.
Thank you very much, Sridhar. Gabriela, you said at the end of your presentation, this effect of an ecosystem, that the fact of not having quick availability would have for the vaccination. You said that this is a condition to have more variables and perpetuate the problem and make it more difficult to manage. That circumstance should make us think about solutions beyond the vaccines. How do you see that? Is there a possibility of thinking about that?
Sin duda, y creo que lo dije en la presentación, las vacunas son una pieza del rompecabezas. Creo que mediáticamente se ha concentrado la atención en las vacunas.
That the attention has been focused in the media on vaccines, and it works for certain political and economic powers. And that excessive concentration on vaccines, which are, of course, are necessary, but won't solve the problem by themselves, or part of that magical thinking. We focus on this global desperation that we have and thinking of vaccines as if having enough access to vaccines, even if we had it, would take us back to 2019 by works of magic. The vaccines are not miraculous, and we won't go back to 2019, such a systemic crisis. To the extent that we continue to allow the pandemic to go wild, and it is still wild, we will continue to find variants of concern that will at some point will overcome the ability of existing vaccines to control the seriousness of the disease or contagion. That's a clear possibility. So of course, we need a higher production of vaccines. The problem is that we're not scaling the production up. We need to increase production, and that can only be done through a collaborative work between many countries and between many sectors of the industry. So we need that. We need to increase vaccination, but we also need some more things. We need medications to treat the infection. We won't achieve a zero rate of COVID-19 disease. So we need additional medications, and we are working really slowly in that regard. Once we have a finally effective medication, or we find the use for an existing medication, we will see the same thing that's going on with the vaccines, hoarding. So we need to enable global access. In addition to this, we need to verify the social conditions so that people can, if sick, isolate to avoid further spreading. Well, so what are the minimum socioeconomic conditions for a person to go into their quarantine, but to do it safely and at peace at their home? And it's impossible in the global south for many people. So what are the distributive justice systems that all states should implement in order for a person to undergo their isolation at ease? And for many countries, this involves tax reform to have solidarity taxes. But there are economic elites and economic sectors that refuse to have the discussions on tax reforms that will allow people to live a good, a decent life. Thank you, Gabriela. And it's in the dynamic where lacks of opportunities and the reluctance of the industry to authorize patent waivers and the pressures on organisms such as WTO will lead to much more deaths, as you already said during your presentation. So who's going to be accountable in terms of human rights? This could be considered a violation to human rights, because those who have the right to live are dying because of lack of decision making by those who are empowered to make decisions. So deaths could be avoidable. So who are responsible? Who is going to be held accountable? Is there the chance to have some sort of global mechanism to assign responsibilities and accountability? What do you think, James, about this?
Okay, thank you. That's a difficult question. I think that every
Es una pregunta
involved in decisions involving these matters should measure the effect on human lives and yeah, from the point of view of human rights, but especially even without raising the level of abstraction to that level, just considering how this will affect the quality of life and the perspectives for life of the people involved. If the decision is being made by a CEO of a pharmaceutical company, whether or not to authorize production by a factory in Brazil of a vaccine that the company has the patent to, and other information and technological resources that could help, I think this would be the thing to do. Bureaucrats in all different situations, whether they're in the World Health Organization dealing with various diplomatic problems, should try to make the best decisions, and especially people like deputy ministers in and prime ministers and presidents in important and less important countries should try to keep uppermost in their mind the effects of decisions concerning the ongoing pandemic on the lives of everyone. And there was another point. Anyway, I will stop my comment there for the moment.
Gracias, James. Muchas gracias. Sridhar, ¿qué opinas sobre este punto?
Sridhar, what's your take on this point?
So, the accountability question, it has many dimensions, and you pointed out many dimensions to it. I'll just take two parts of it. One is that I am not optimistic that any government official or elected official will be held accountable for any of the actions and failures that have occurred, because it's such a crisis or pandemic crisis that people will find lots of different ways to say we did the best that we could given the situation. And then once you give that kind of answer, there isn't very much that you can say in response, except to say what are the lessons that we can learn for the future, etc. There is profoundly in every country, but also in the UK where I'm currently, there's a profound amount of corruption that has occurred, not minor corruption, mega corruption. And this has always been a problem in before, but the scale that we're talking about is in the billions, and it's not, as I sort of jokingly tell my friends, white people corruption. This is very different from the kind of corruption that we've been talking about in developing countries regarding nurses asking for money for injections, or a healthcare system, sort of where people are sort of suddenly money dispersed. This is huge amounts of money that has been made through kind of official ways, because somebody was given a contract and somebody signed a contract, and therefore it's all legitimate, etc. So I find this going to be a very long process for expecting any kind of legal or other kinds of accountability. But I am optimistic on two other kinds of accountability. As my mentor and teacher, Amartya Sen, always talks about, is democracy is a great accountability measure. And the way that you hold people accountable, especially politicians, when they fail, is to not re-elect them to office. And this is what every politician wants more than anything, is to get into office again. And so the way that we hold people accountable is that we make sure that we don't re-elect them, even though they failed enormously during this great crisis, but perhaps when we needed political leadership the best. The second thing is that, I'm hopefully speaking to all of you who are ethicists or some sort of philosophers. The great job that we have is to create the moral norms and moral standards. And I hope that what we do is that if there is no legal or political accountability, at least we can show the moral failures and sort of identify the moral norms that need to be upheld. So the least that we can do is sort of identify the moral standards, the social and ethical values that we stand for and how they were violated or neglected during this crisis and how they need to be identified and realized in the future. Thank you.
Gracias a ti, Sridhar. Y un poco en esta línea, Gaby, para que un poco cierres.
Thank you, Sridhar. And Gaby, in order to close today's session, I would like to readdress the question that received by one of our attendees. How can we take that leap? How can we effectively reach or achieve or get these ethics issues to become the guiding principles and not just be those topics that philosophers just dedicate themselves to ponder over, but to have the ability to affect how our societies in a practical way. Oh, you gave me the toughest question. Well, that's what we do with our Costa Rican guests, usually. Well, it's a tough question and it's quite painful, actually, because it poses or faces us with an inability that we continue to drag with ourselves to transfer the discussion to broader spaces, especially in decision-making realms. As Sridhar was saying, and by quoting Amartya Sen, democracy is the best route for accountability. And we could also say that democracy is the best route to live or to bring basic human agreements to public policy. That's what the theory says, and that's what we write in our academic articles. But that's not what's going on in reality, at least not in Latin America. We're, in fact, through democratic processes, we are bringing anti-democratic practices. That's the reality in many countries in the region. Central America is the most dramatic example of this. We have Costa Rica and what's going on in Nicaragua, where during the last weeks, Ortega has actually kidnapped and arrested all those who were running for elections, those who could be rivals or him against him in a presidential election. It's happening today. So we turn back to our look on social movements that receive all the violence and the repression of authoritarian governments. However, at this point in time, I couldn't think of another way to bring the demands for justice and human rights into the public speech, but through a diverse social mobilization, diverse in all ways. We can't just think that we all are on the same page or think on exactly the same on anything. Latin America needs to learn how to mobilize from the grassroots on minimum agreements. Human rights, we don't need to discover new things. We need to agree on minimum in order to have a broad mobilization that respects differences and the search to be non-violent, but to be drastic on their demand for changes in public policy in our countries. Thank you, Gaby. You surely have touched on key things that have a lot to do with what's going on in Colombia, where I am right now, and a topic that will surely have electoral effects, as also Sridhar was saying, in the words of Amartya Sen. So I want to close a wonderful session that we've had on this topic of global justice regarding vaccines. We have had very significant and interesting contributions and points of view. I wish to thank our colleagues Professor Sridhar Venkatapuram, Professor James Crombie, and Professor Gabriela Arguedas for having joined us in the session. We also wish to thank the entities that came together to support this event, including Universidad Autónoma Latinoamericana and International Research Group for Justice, led by Professor Venkatapuram. On August 5th, we will be holding an event focused on the ethics on development from the standpoint of the challenges and dynamics in the metropolitan area of Medellin, and a case study on the possible challenges for the country, talking about mobilizations, rights claims that have been a central point. We will also have another event in September, all of them as a preamble to the conference for next year, also in Medellin in July. It's about development in times of conflict, and in September we'll have an event on ethics of development, talking more specifically about the violent conflicts. And in October or November, we'll have an event on epistemic justice. We will let you know in a timely manner, and we hope you can join us. Having said that, thank you very much.
I am very proud for conducting this panel. Muy orgulloso de haber estado con ustedes y seguimos en contacto. Muchas gracias.
And I'm very proud, and let's stay in touch. Thank you very much.
Thank you very much. Goodbye.
Thank you. Bye. Thank
Thank
you,
you.
Sridhar.
Great seeing you all.
Gracias. Great.
Thank you.
Everything.
Bye.